Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Baby baths. Introduction. Knowing how to bathe your baby properly is important. Learning the basics of bathing your baby is the first step in keeping your baby safe during bath time. Giving your baby a bath can be stressful, especially if your baby doesn't like it. However, knowing what to do can give you confidence and help you and your baby get used to bath time. This program will help you understand how to give your baby a bath. It discusses how to prepare for a bath and reviews the different types of baths for babies. A section on bath safety is also included. Baby baths. During their first year of life, newborns don't need to be bathed every day. In fact, you should only bathe your baby 2 or 3 times a week during his or her first year. It is not good for your baby to bathe too often. It can cause your baby to have dry, sensitive skin. Use a hooded towel for bath time. This helps keep your baby warm after a bath.
Most babies don't need moisturizer or lotion. Newborns may have flaky skin. This is usually normal. Make sure any moisturizer you use is free of fragrances and chemicals that might harm your baby. Ask your healthcare provider to recommend the best type of moisturizer for your baby.
You can prevent rashes by thoroughly drying your baby's skin after each bath. Make sure to dry in all the skin creases. Usually all you need to bathe your baby is plain water. If your baby is dirty, you can use mild baby soap. Don't use regular soaps that you might use for yourself. Preparing for a bath. Preparing for your baby's bath can make bath time less stressful. It can also make bath time safer for your baby. Make sure you have all essential supplies nearby. This can include mild baby soap and shampoo, washcloths, and any other necessary supplies. Having these supplies ready keeps your baby safe. Have a warm towel to use immediately after your baby's bath. It is important to dry your baby off after each bath to prevent rashes. Also, having a warm towel ready will prevent your baby from getting too cold. Have a clean diaper and baby wipes set up. That way, once your baby is dry, you can easily put a new diaper on. Also, have clean clothes out and ready. Getting your baby dressed after a bath helps him or her warm up and feel more comfortable.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Sponge bath. Sponge baths are recommended for newborns until the umbilical cord falls off. This could take 2 to 3 weeks after birth. A sponge bath means wiping your baby with a wet sponge. You should not use a tub or pour water over your baby for a sponge bath. To give your baby a sponge bath, make sure you choose a warm place. Also, pick a flat surface such as a countertop or changing table. If it's warm enough, you could even give your baby a sponge bath on a towel on the floor. First, make sure you are prepared for the bath. Then spread out a blanket or towel for your baby to lie on. You can also use a changing pad if you want. Fill a basin with warm water. Make sure the water is not too hot. You can also fill a sink with warm water if you are doing the sponge bath on a countertop near a sink. Next, undress your baby and wrap him or her in a towel. Lay your baby on the prepared blanket, towel, or changing pad. Only expose the part of your baby that you are cleaning. This will help keep him or her warm. Wet a washcloth with the warm water and squeeze out the excess. Gently wipe your baby's face with the wet washcloth. You don't need to use soap. Wipe your baby's eyelids using either a wet cotton ball or cotton cloth. Start at the inside and wipe to the outside corner. Next, use the washcloth to wash your baby's body. Soap is not necessary. However, if your baby is dirty, you can use mild baby soap. Make sure you wash all your baby's creases in the skin. Also, make sure you clean behind the ears, around the neck, and between fingers and toes. Tub bath. Talk with your healthcare provider about when it is safe to give your baby a tub bath. Make the first tub bath short. If your baby gets too upset, you can always go back to sponge baths and try a tub bath again later. There are many different types of tubs you can choose from. There are some plastic bathtubs specifically for babies. Some parents use plastic bins or inflatable tubs that are put inside your bathtub. You may also use the kitchen or bathroom sink if you use a towel or rubber mat for lining. After all the other preparations, you should also have a cup handy to rinse with. This will help you keep one hand on your baby all the time. Fill the tub before you put your baby in it. Only fill the tub with 2 to 3 inches of water. Make sure the water is warm, not hot. You should pour warm water over your baby throughout bath time. This will keep your baby warm. It is also important to make sure the room you are giving the bath in is warm. When your baby is wet, it is easy for him or her to get too cold. Make sure you hold your baby securely during a bath. This is especially important because your baby can be slippery when he or she is wet. Always grasp your baby under the armpit and make sure you are supporting your baby's head. Use a soft washcloth and start with your baby's face. Wash the dirtiest parts of the body last. Make sure you get in all of your baby's skin creases and rinse the genitals. You can wash your baby's hair if it gets dirty. You should also wash your baby's hair if he or she gets cradle cap. Cradle cap is common and is when scaly patches of skin appear on a baby's scalp. To wash your baby's hair, support his or her head and torso with one hand. Use your other hand to gently rub a small amount of mild baby shampoo into the scalp. Make sure to cover your baby's eyes when you rinse his or her scalp to prevent soap from getting in them. Bath safety. Knowing how to properly bathe your baby is important to keep your baby safe. Here are some quick tips to help keep your baby safe during bath time. As previously mentioned, if you give your baby a tub bath, fill the tub up with 2 to 3 inches of warm water. Do this before putting your baby in the tub. Avoid filling the tub with more water to prevent drowning. Always test the water temperature before using it on your baby. You could burn your baby if the water is too hot. Keep one hand on your baby at all times. If you are giving a sponge bath on a changing table, use a safety strap to gently secure your baby to the table. Always support your baby's head. It only takes a few inches of water for your baby to drown. You can prevent this by supporting your baby's head. Most importantly, never leave your baby alone. There is no reason for you to ever leave your baby unattended during bath time. Having everything prepared before the bath can help you prevent drowning.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Knowing how to bathe your baby properly is important. Learning the basics of bathing your baby is the first step in keeping your baby safe during bath time.
A sponge bath should be done until the umbilical cord falls off. After that, tub baths can be given. There is no reason to ever leave your baby alone in a tub. You should always prepare before a bath by moving everything you need close by. Also, lay out a new diaper and clothes so that your baby can be warm and comfortable shortly after a bath. During their first year of life, newborns don't need to be bathed every day. In fact, you should only bathe your baby 2 or 3 times a week during his or her first year. Giving your baby a bath can be stressful, especially if your baby doesn't like it. However, knowing what to do can give you confidence and help you and your baby get used to bath time. Thank you for using Explain.